Today I'm going to tell you about wisdom teeth. A wisdom tooth, or third molar, is one of the 3 molars per quadrant of the human dentition. It is the most posterior of 3 molar teeth that we have. Wisdom teeth usually erupt, meaning coming out from the gums, between ages 17 and 25. They are the third molars, and ancient humans used wisdom teeth to grind up hard foods that were difficult to digest. Since cooking meals arrived, humans have outgrown wisdom teeth, and most can be removed before they erupt without any effect on a person's natural chewing pattern. Most people assume that wisdom teeth always need to be removed, but that's not always the case. In fact, some people have wisdom teeth grow perfectly into their smile without crowding or issue. However, most wisdom teeth need to be removed before they erupt to prevent potential crowding problems. There are many reasons to have wisdom teeth removed before they arrive, but they can only be discovered by a dentist using advanced imaging to assess the position and health of an incoming wisdom tooth. Wisdom teeth need to be removed when they will negatively affect the health of surrounding teeth or the mouth. Most people that need their wisdom teeth removed have it done between the ages of 16 and 18. If there is not enough room for wisdom teeth to erupt, they can become impacted, which causes them to grow in sideways and is a reason for removal. Wisdom teeth can also push against second molars, pushing them out of alignment and making them more difficult to clean and susceptible to decay. Additionally, narrow spaces between molars can become more easily infected with bacteria, which raise the risk of periodontal disease, inflammation, and decay. Wisdom teeth removal is usually done under anesthetic, so the procedure itself is not painful at all. However, the recovery period after wisdom tooth removal can be uncomfortable. Soreness, swelling, and limited mouth opening can last anywhere between 1 and 4 days. A typical recovery period after the extraction is over with is dependent upon how impacted the wisdom teeth are, how large the teeth are, and how deep they are when they are extracted. Wisdom tooth extraction surgery involves making an incision through the gum tissue that presides over the tooth, gently detaching the connective tissue between the tooth and the bone, removing the tooth, and suturing or sewing the opening in the gum. Occasionally, some bone surrounding the impacted tooth needs to be removed to allow the tooth to be extracted. Also, the tooth may need to be cut into sections to remove it. Most wisdom teeth extractions are performed in the dentist's office under local anesthesia. People who are particularly anxious should consult their dentist or oral surgeon about supplements to local anesthesia or alternative forms of anesthesia. If your teen is experiencing pain in the very back of their mouth, then it may be time to evaluate how their wisdom teeth are growing. Go to your dentist and have it checked and see if they need to be removed. Of course, you could get lucky. Not everyone has wisdom teeth. One estimate says that about 35% of the population is born without them. Unfortunately, immediate removal of your wisdom teeth is not always possible. Sometimes, a patient is not able to get into the office for several days or weeks for a variety of different reasons. However, the pain is still there and the need for relief is real. What can you do? Here are a list of options. Saltwater rinse. This should be the first line of defense for wisdom teeth coming in incorrectly. There's 2 reasons for this. First, the warm water will provide comfort to the aches and pains your mouth is experiencing. Second, the salt water is a natural antiseptic and it will help keep the possibility of infected gums at bay. Apply ice. Warm salt water not giving you the relief you want? Consider trying the polar opposite and apply ice to the side of the face where the wisdom teeth are coming in. You can use an ice pack or simply put some ice inside of a zip-top bag. If your skin gets too cold and uncomfortable from the ice, wrap a towel around the pack. Medicated gels and ibuprofen. There are many different medicated gels on the market that are made to relieve tooth pain and discomfort. These gels are squeezed directly onto the affected area and numb the gum and root for several hours. Before using a medicated gel, make sure you read the directions and warnings to ensure you are using it correctly. If you're needing something a bit stronger or longer lasting than a typical gel, consider taking ibuprofen. Although you won't want to take it nonstop until your surgery, it is helpful when the pain cannot be tolerated any other way. This is especially true at night when sleeping may be difficult. Home remedies. There are many home remedies available that have not been extensively tested, but that people swear by. You can attempt some of these to see if they give any relief from wisdom teeth coming in. They include tea bags. Place a moist tea bag, cold, not hot, directly on the affected area. If you are able, gently clench down on it. Cucumber slices. Following the same procedure, place a slice of cucumber on the ailing tooth and apply gentle pressure if possible. Onions. Although many will find this option odious, pun intended, there are some who swear by this method. If possible, chew the onion slice for a maximum effect. These types of remedies can often bring some comfort, but if they don't, you won't suffer any negative effects from trying them out. Call your pediatric dentist. If none of the pain remedies above work for you, you may need to consider consulting your pediatric dentist. Your dentist can provide you with prescription pain relief, often in the form of a topical gel that is easily applied directly to the mouth. What should be eaten after my wisdom teeth removal surgery? A liquid diet of liquids and soft foods, including yogurt, pudding, and smoothies, is recommended the first 24 hours, but do not drink from a straw since the suction can loosen blood clots. Then, it's a soft food diet for 4 to 5 days. Think mashed potatoes, scrambled eggs, and pastas. Avoid anything that requires significant chewing and opt for colder foods that will feel soothing. Thanks for watching this episode of Adventurous Kids.